Good evening and welcome to ATP Live Monday. Good evening, everyone. Welcome. So, another episode of ATP Live Monday, and I'm just going to share our video and pin it, and then we can start. How has your day been? I hope we've had a beautiful Monday so far. All right. Just going to. Okay. So, welcome everyone to Atp Live Monday. I am Gbemisola Boyede, and I'm just going to share the video and we can start. Welcome, whichever platform you're joining us from, on Facebook, on YouTube, on Instagram. You're welcome to ATP Live Monday. ATP Live Monday, Miss Fumi, good evening. You're welcome. Any questions that you may have about the health of your children and life. So I'm just going to share to our groups. And then we can start. Okay. I should guess it's my phone. So welcome everyone. If you have any questions, you can start to drop your questions while I'm doing the sharing. I just want to share the post first so that everybody can see us and they can hear us. So just give me a few minutes to do that, and then we can start. But you can start to drop your questions now. So we just got an hour where you can ask any questions that you may have about the health of your children, and I will try and answer them in the next 1 hour. Okay. So I'm almost done just doing all the pinning now. Okay. That's my okay. I think we're almost done. Okay. So welcome everyone. I hope my internet is not too slow today. Let me just try and see if I can open create more access for internet. All right. Okay. So welcome everyone to ATP Live Monday. I am Gbemisola Boyede, and I'm your host for this session. This program is brought to you by Atp Pediatrician's Foundation. So you get to ask any questions that you may have about the health of your children, and we will try and answer them in 1 hour. But just to let you know that if you have any questions after the live session, or if you are watching the repeat broadcast after the live session is over, you can still get answers to your questions. Just head over to our Ask the Pediatrician Facebook group, and you can post your questions there from Mondays to Saturdays, and we will be able to answer your question. And we just finished breastfeeding week last week. I hope we all learned a lot. And well, if you still have any question, you're welcome to also ask your questions till today. So I will start now. We've got a question already on Instagram from Miss Fumi. I said, Doctor, is toothpaste with fluoride safe for a 1-year-old baby? Of course, the answer is yes. We want one for every child, even for adults, for toothpaste, you should always use fluoride containing toothpaste. So fluoride containing toothpaste, the fluoride protects your child's teeth against tooth decay. And our dentists have been here many times to teach us about how to prevent tooth decay. And they've always recommended fluoride containing toothpaste for everybody, including children. However, the quantity of fluoride varies depending on the age of the child. So for the younger children, it's a little bit smaller compared to for adults. And that is why there are toothpaste that are for age that are age appropriate. And what is the difference is just that quantity of fluoride. So when you want to buy fluoride containing toothpaste for your child, make sure you buy the one that is for the milk teeth, the one that is for children. Usually they will rather write the age, say maybe 1 to 6 or something. They will write the age on it. So always go for age appropriate toothpaste when you're buying toothpaste, but definitely it must contain fluoride. And a follow-up question people always ask is, when do you start to use toothbrush and toothpaste? Actually, once the child has their first tooth, you should start using toothbrush and toothpaste. So a lot of parents just use cotton wool and water or so. No, only you can see a tooth, even if it's just one, you should buy age appropriate toothpaste, age appropriate toothbrush. Sometimes you may start with the finger brush, soft brush, and the quantity, because children don't spit out the toothpaste after you brush their teeth. They usually swallow it, which is why you must make sure you put the right quantity, and what is recommended for the children less than 3 years is a grain of rice. If you remember rice, uncooked rice, so not the cooked one that are swallowed up, the uncooked rice, that grain of rice, that is the quantity of toothpaste we should put on the toothbrush, soft toothbrush for children 0 to 3 years. After the age of 3 years, you use a pea-sized toothpaste. The pea-size, or granules, like some of us, that's quantity is what we should all be using. I know most of the adverts we watch on our TVs on advertising toothpaste, they tend to splatter the toothpaste on the toothbrush. They will rub it up to the end and even put a cuff at the back. That is too much of toothpaste. So at least for children, because obviously adults you can spit out easily, but for children, because they tend to swallow their toothpaste as well. So make sure you put the right quantity. Grain of rice from 0 to 3 years, a pea size from above 3 years old for children. And and they should brush their teeth both twice a day, in the morning after breakfast and at night after dinner. So that is what we want. And all that is to make sure the children do not have what we call tooth decay. So I hope that's helpful. All right. Thank you. So for those who are just joining us, welcome to ATP Live Monday. Feel free to ask any questions that you may have. If you are watching on the groups, please you remember that you have to click on the video so that we can see your questions rather than just the if you just put your question on the group, we will not say, but you have to click on the video. So yeah, your question is actually under the video, then we can say it. Yeah, but if you're watching on Instagram or Face or YouTube, you can drop your questions directly and we will be able to say it. Okay. So Miss Fumi said, thanks, Doctor. Well understood. Okay, great. I'm happy you catch that already. Feel free to ask questions. I'm just checking whether we have any questions in the group. Okay, no. All right. So I've not seen any question on Facebook yet. So um, feel free to ask your question if you have any question about the health of your children. And just to remind us that you can always ask your questions on all our uh, platforms, especially our Facebook group, Mondays to Saturday. We're always there to answer your questions, Mondays to Saturdays. And if you want to read about any of these important topics, that's any health issues really, as far as it has to do with children, feel free to go to our website www.askthepaediatricians.com, and you can post your questions there and we'll be able to answer it for you. And you can also listen to our podcast. Ask Dr. Gbemisola ATP is available on all the podcast platforms, Spotify, Amazon Music, Google Podcasts. You can anywhere, just type Ask Dr. Gbemisola ATP podcast and you will be able to listen. But if you like to read, you can read on our website. If you like to watch, you can watch on all our YouTube channels, because Facebook tends to take down live videos now after like a month, but all the videos are always permanently available on our YouTube channels. All right. So welcome everyone. Feel free to ask your questions. We just got 1 hour so that we won't be struggling towards the end. Okay, I got a question on Facebook. Nika, good evening, Isiani. What makes a 5 weeks old baby vomit through his nose after breastfeeding? We are on exclusive breastfeeding. Okay. Thank you, Nika, for that question. A lot of parents use the word vomiting a lot for anytime babies bring out food back, either through the mouth or through the nose. But I always like parents to clarify whether the child is actually vomiting or the child is actually having what we call reflux. They are two different things, and it's so important to know the difference between a child who is having reflux and a child who is actually vomiting. And the difference is the how actively it happens. So usually for reflux, it's something that happens passively or gently. So the child is otherwise well, then a little bit of the milk come out from the mouth or from the nose, most usually from the mouth anyway. But vomiting, there's so much of force. It is forceful. The child is retching, and you see that when the milk is coming out, it's not just coming out a little bit gently from the mouth, or is forceful, is projected forward, and it's usually a lot. So that is vomiting. So it's always important to differentiate between reflux and vomiting. Reflux is quite common in babies, actually, because most mothers, when we finish feeding our babies, we tend to just put them down on the bed, because most of the time they slept off when they're feeding, and then you just go and put them down. And so because they have a very small tummy, and the space between the tummy and the mouth and the nose is actually very short, and it's liquid food anyway, so it's easy for the food to go back, and that is why it comes out. So what we normally recommend is, don't put baby down immediately after feeding them. Try and keep them upright. Okay, keep baby upright after feeding them. Even if they slept up, don't go and put them down straight away. Keep them in a upright position. You can put them over your shoulder or wherever, and just pat their back. Some of them will bop a little bit. It's not compulsory for them to bop, but it's okay to allow the milk to settle down a bit in their tummy for 15 to 30 minutes. At least some digestion would have started, and so it will be difficult for the milk to, it won't completely eliminate, so a little bit will still come out, but it will be less compared to if you just go and put them down straight away. So babies tend to have reflux. It's one of those common things in babies. We don't worry about it, because as baby gets bigger, by the time they start sitting down, it reduces, and by the time they start taking solids, or especially by the time they start taking more of solid diets, by age of 1 year, it will all gone completely. So what we can do is just reduce it at this point. Some babies tend to have what we call very severe reflux. So severe reflux, they bring out, they make quite a lot, even if you do all the things I've said, like keeping them upright, up to 15-30 minutes. If the baby is still bringing out a lot of the milk, our baby is losing weight, then that's what we call severe reflux disorder. And in that case, sometimes we have to give the children medications. We sometimes have to give them what we call milk thickener, something that will make the milk thick and stay down. Not formula, but there's what we call breast milk thickness. So we can sometimes use that. But most babies don't have that. Majority of babies just have the normal reflux that is mild, and it will just resolve. So it's not something to worry about. But try and not put baby down straight away. Okay. So I'm happy you said it's reflux. So for reflux, there's something to worry about. However, some babies actually have very severe vomiting. And there are many things that can cause severe vomiting. Actually, things like children having infection, sepsis, or even what we call pyloric stenosis, where there is an obstruction in the stomach, and that actually require an operation. So which is why we don't joke with vomiting in babies as well. So any baby who is not having reflux but is actually actively vomiting, those ones need to see a doctor. So that is why it's so important to differentiate between reflux and vomiting, because reflux, you don't have to go to the hospital. It's something that will go away on its own. But vomiting may be a sign of a serious condition like pyloric stenosis that may even require an operation. So that is why it is very important to differentiate between the two. So I hope the answer is clear. Okay, so that is about that. And that's one excuse not to keep breastfeeding the babies. And sometimes some babies, we breastfeed them so much. Like sometimes mothers need to realize that babies sometimes suck, not because they are hungry, but they just like to suck. And because they like, the feeling of the mother being close to them. So even when their tummy is so full, they keep sucking and sucking. Sometimes some of those babies will actually bring back part of the meat because we have overfed them. So if you think baby is full, the tummy is already, you can see the tummy is even bulging, you can actually stop feeding them at that point, because sometimes they just want to suck, not because they are hungry, but because of just sucking for purpose of sucking. All right, thank you so much. Let me check on Instagram. Instagram people, I see you, but I can't see any questions. So if you have any questions, feel free to ask your question. A lot of parents, there are lots of awareness going on about some immunizations that we do come to give the children at home or in our churches. We call them supplementary immunization, and a lot of parents wonder why they should still take those immunization even though they've already gone to the hospital and they've taken the routine immunization. So I say I will talk about it today. So there are immunization that we expect you to come to us to collect. That is what we call the routine immunization. When you come to the hospital, we will write in your card your child has taken BCG, or your child has taken Penta, HPV, and all that. We normally document all those ones in your card. We call them routine immunization, and it's so important for you to know how many your child is going to take each time you go to the hospital. I see a lot of, my mother was asking me recently, oh, that he gave two on this one on this one, and she was like, is that correct? Is that okay? So it's because we shouldn't be going to the hospital ignorant. You should know when you are going to the hospital that these are the vaccines my baby should be taking today. That's why you have that card. That's why you are an educated mother. That is why you can read, because all those information, they are there for you. So don't go to the hospital completely clueless. You should know these are the immunization I'm going to get at 6 weeks, at 10 weeks, at 14 weeks. So even if, so then when people want to make mistakes, you can always clarify it straight away. So and obviously the health professionals also should know what to give, but sometimes human errors can happen. But so if you as a mother, you already know, then you can, and always let them know the age of your baby before they inject the baby, because I see a lot of mothers say, oh, they said they gave my baby the 10 weeks immunization, when it might be 6 weeks, or they gave the 14 weeks. So be conversant, and just before they give immunization, always tell them, this is the age of my baby and this is the immunization my baby is going to take. Can you confirm? It's okay to do that so that we all are sure. I always don't like it when after the error has been committed, that's when mothers will start coming to ask us questions. Of course, there's nothing we can do about it. Luckily, most of the time, there's no harm in taking extra doses of immunization. It's just a waste most of the time, but there's no harm anyway. But it's still good for us to know and what to expect. And now there are also immunization that you don't come to us, we come to you as the health professionals to give. We call those ones supplementary immunization, and there are reasons why we give supplementary immunization. Most of the time we are targeting a particular disease that we're expecting, or that is already there's an outbreak of that particular disease. For example, when we expect that we're going to have a measles outbreak, we start going around giving measles immunization to everybody, even those who have collected measles already at 9 months and at 15 months. Is because we want to kind of boost the immunity of the children and hopefully catch those who didn't even take before, maybe their mother forgot. So it is still okay to take those extra immunizations. Don't say, oh, well, I've already taken my own measles. Yes, but if they still come to give to you, or they write to you at home to say you're maybe in the nursery or in primary one, wherever, I usually give to children up to the age of 5 years, we're going to give them an extra dose of measles vaccine. Please take it, because at that time we're trying to boost the immunity of the children against a particular outbreak. So we want them, just in case the immunity has dwindled a bit, so giving them that extra dose is going to boost it. So it's okay to collect those supplementary immunization. Another one we normally give is the polio, because we are working so hard to kick polio completely out of Nigeria. We want Nigeria declared polio free, and we are close to it right now. So sometimes we go around giving extra doses of polio vaccine. That's the one we drop in the mouth. It's okay to take them, and your children cannot take too much of them. Don't be worried that, oh, will they overdose? Don't worry, they're not going to overdose on those vaccines. All right, it's better to take the extra dose even if they don't need it, and we are sure they are protected, than for us not to give them and then they are exposed to polio, white polio, and they have polio disease. So we're trying to make sure that no child has polio. So all those immunizations that we're going to, I think we're doing some measles boost, and also some places may be doing polio. Please feel free and don't be afraid to take this immunization. If you are worried that maybe some people are scams, ask them for their ID cards so you can identify them. Most of them will wear their health care professional, like an apron or something, but they also have ID cards, so you will know that they are genuine people coming to immunize our children. So feel free to take the vaccines. All right, I think I should just create that awareness. Okay, another question we have from Udrak. Say, good evening. My 5 months baby groans a lot, okay, as if he's passing a hard popo, but not poo. Okay, it does it as fun. I don't know if it's normal. So babies make a lot of noises at times, and sometimes I find it easier to just tell mother to send me a video of the noise. And 99% of the time, the videos are normal videos. So baby make a lot of sounds. I think for me, it is, how is that baby when baby is doing the sound? Baby is happy, baby is smiling, baby is uncomfortable, is comfortable, it's not showing any sign of discomfort. Most of the time they are just having fun. There's nothing wrong with that. Okay. And so, but if you are not quite sure whether this is a groaning from pain or a groaning from something is wrong, then you can always do a video. Thank God we're all using camera phones these days. Do a video, show your pediatrician or show any of the doctors, and we can straight away tell you, oh, this looks normal. But most of the time, even if you yourself as a mother, from what you said now, I'm not particularly worried about your own case, because you already said the baby is doing it as a play or for fun. So obviously maybe it's not uncomfortable, maybe it's just having fun. So we are not worried. Usually children don't pretend, which is why I like pediatrics. That's one of the reasons why I chose to be a pediatrician and not an adult doctor. Our children are very, careless. They What you see is what you get. So if a child is happy, a child is not in pain, they are playing, they are happy, and that's it. But when children are sick, you will see that everything is down, and and once you see them as a pediatrician and you do your needful, So I love it when they bring children to me, very sick, very, almost as if the child is dying, and you're able to quickly identify, oh, this child is short of blood, or this child is in shock or something. Boom, 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 you quickly administer your treatment. They follow that same day, maybe by afternoon, you will see that child running around in the hospital. So it's always so encouraging. It's as if, yeah, wow, you can see the effect of your work straight away. I love that about children. Unlike adults, sometimes when they are well, they are seen, squeezing their faces and pretending. But children don't pretend. So basically, I'm saying that if your child is happy, playing, and all that, no matter the sound you think the child is making, most likely there's something wrong. But if the child is looking down, the child is not eating, the child is crying, the child is upset while making those sounds, then I will worry more about that. And then you can always come and see us at the hospital. So you don't have to worry. And some children also make those sounds for the newborn babies. Even when they are passing gas or passing urine, they make this grunt, what look like grunting sounds. But the poo is not hard, the poo is soft, nothing is wrong. So a lot of first-time mothers worry about that as well. It is nothing to worry about, as long as there's nothing else wrong with them. So it's just one of those things as well that we don't need to worry about. Okay. All right. If you still have any questions, feel free to ask your questions and we will answer them. We still have about half an hour to go. But for those who may come late and or maybe who are watching the recording after, if you're not watching between 6 and 7 p.m. West African time, Nigerian time, most likely you're not watching the live session. And a lot of people come to drop questions after the live session is over. Of course, at that time, I won't be there to say. So for those people, don't drop your question if it is not live session. Please post your question to our group and we'll be able to answer them on the group. Our group is open 24/6, Monday to Saturday, so you are free to ask your questions there and we'll be able to answer them. Okay, Instagram people, no questions today. All right. Okay, so let me just continue to create my awareness and about the immunization I was talking about. So the booster immunization, the supplementary immunization we give to our children, it is okay to take them. Another question somebody was asking is also about the what we call seasonal malaria chemoprophylaxis. Some people, they will come to your house and give you some malaria tablets to give to your children to take. And not that your child has malaria, but the health workers will come and say you should give it to your child. And I think they will come almost like every month and say you should give it to the child. It's okay to also take them. Okay, I think they tend to give Fancida. We call it malaria, seasonal malaria chemoprophylaxis. It is not in all over the country. There are some parts of the country, especially in the northern parts of the country, that we do that because malaria in those places tends to happen at certain seasons. Usually it tends to happen more when there's a lot of rainy season, there's a lot of water storage, lots of mosquitoes. So So we want to make sure that our children are protected against malaria, because the babies, children 0 to 5 years, they are prone to what we call severe malaria. So most of us, we have malaria as adults, and we're still going to work. We're still doing everything, So we are kind of semi-immune against malaria. So we have malaria, we know, but some of you don't even go to hospital, you treat yourself and you just carry on. However, so most of the time what we have is what we call simple malaria, and because you are semi-immune against malaria, you will still be able to function even when you are taking your anti-malaria and all that. But there are certain group of people that tend, when they have malaria, they tend to have what we call very serious, severe malaria. So children less than 5 years, pregnant women, children who have sickle cell anemia, or children who have cancers and all that. When those kind of children have malaria, they tend to have what we call severe malaria. In other words, they tend to be very sick. They may need hospital admission. Their blood may become very low, anemia. They may have jaundice. They may have uh, uh, what we call kidney failure as a result of malaria. Some of them may become unconscious. They can have what we call cerebral malaria. So those are the kind of people that tend to die from malaria. Most of us have malaria, we don't die, but children less than 5 years, when they have malaria, they tend to have severe malaria, and those are the ones that can die from malaria. And also pregnant women as well, and people with sickle cell anemia. So those category of people, we want to make sure they don't have malaria as much as possible. We want to protect them. And there are many ways we do that. The way we're doing it, which is being introduced now, is we actually giving immunization to children 3 to 12 months against malaria. The immunization does not mean they will never have malaria, but it will protect them from having the severe malaria, because that is what we as doctors we are worried about. We are worried about the severe malaria, because that's severe malaria that can kill the children. So so immunization is being rolled out. It's not yet universal. In other words, it's not yet in every state, and it's not yet even in the national program on immunization, but it is being rolled out. So hopefully some states, I'm sure you've already started taking malaria vaccines for your children, but other states, you soon get your turn very soon. We'll keep you updated. But while we're still rolling out the immunization, the malaria vaccines, another way which will protect by which we protect children against malaria in some places that tend to have their own malaria seasonally, is what we call the malaria chemoprophylaxis. So we can protect against malaria by giving immunization injections, or we can protect by giving drugs to protect against malaria. So chemoprophylaxis is what we do in some places, and we also what we do for pregnant women as well. So pregnant women, you're supposed to take Fancida from your second trimester every month. I hope you're aware of that. So if you're going to your antenatal care, please be aware that you're supposed to be getting treated. This is not that you have malaria and they are treating you. No, this is they are giving you drugs ahead so that you will not have malaria. Okay, the same thing for children. So in some places they will give children 3 to 12 months malaria drugs during this period, just to protect them from having malaria. So we call it malaria prophylaxis. It is perfectly okay for you to also take those tablets as well. In some places, it is not. We don't do chemoprophylaxis because malaria is all year round. So I think it's mostly in the north part of Nigeria, middle belt north, that tend to do the malaria chemoprophylaxis. Most of the time in the west, we don't tend to do it yet. All right. I have a question from Instagram. Sonia, it said, "Good evening, ma. Is the daily multivitamin necessary for a 22-month-old baby?" The answer is no. The answer is no. There's no reason to give our children multivitamins daily. I know a lot of us do that. Even our babies, 0 to 6 months, we just finish breastfeeding week, and we say breast milk only, including multivitamins. They are not necessary to be given to our children. And I know a lot of mothers will like, are you serious? Yes, that is the truth. Because like I always say, and I've said many times on this platform, we want the children to eat their vitamins. We don't want them to take it as tablets. So we want you to give them food that will supply the vitamins. So what are the vitamins? You have your vitamin A to K. So the vitamin, there are, if you remember your biology, there's what we call the fat soluble vitamins and the water soluble vitamins. Water soluble vitamins are vitamin B and C. You can get them from your fruits, from your vegetables, your folic acid and your vegetables and all that. Your carrots will supply even you carotene, which is a precursor of vitamin A as well. And vitamin D, you get some from the sunlight. Vitamin E as well, some food. And vitamin K, we tend to give your babies as injection at birth anyway. So we want you to eat those vitamins, the ones that are edible, rather than give them as tablets to the children. So as much as possible, if our children are eating well, because most of those vitamins, they don't need a lot of them. We also give vitamin K. Vitamin K is also vitamin A. We also give vitamin A as part of supplements during immunization. So we also encourage people that make sugar, flour, and all those basic staples that we all eat at home. Most of them have been fortified with vitamin A. Once you see any products and they drew an eye, the eye on it. If you see an eye on any products, maybe your flour, your sugar, your butter, is because they've added vitamin A to it. Because we know most children will eat from those kind of products, so we encourage the manufacturers to add vitamin A. So there are lots of sources of these vitamins to our children, and lots of the fruits, they are loaded with vitamin A and C as well. So those are the way. If our children are eating well, they will get all the vitamins from food. Okay. However, some people will say the children are not eating well, they don't want to eat fruit, they don't want to eat their veggies, blah blah blah. So if you are struggling with making sure the children take their fruits 5 a day and all that, yes, you may want to supplement with vitamins. But what I always want parents to know, that for anytime you are giving your children drugs, in addition to whatever they told you you are giving, there are many other things you are giving to the children that people are not telling you the names, because there are things they have to use to dissolve the vitamins. There are things they have to use to preserve it so that it will stay in a tablet or in a bottle before it expires and all that. We call them excipients. So there are a lot of other things that are going into those products that you don't even know the name of. So, and some of them, there are regulations to make sure we keep them to safe levels. That is why you have NAFDAC and all the regulatory bodies. But we can never always be 100% sure. Even in the developed worlds, people can do you may fall into the hand of people who are unscrupulous and all that. So it's always safer to actually give your children the food. That is always safer than to be giving them drugs as much as possible. But if of course, it's safer, it's better to give the children the multivitamin tablet than for them not to have the vitamins at all, and then end up having what we call vitamin deficiencies. The vitamin deficiencies can be very horrible. So if your child is not eating properly, yes, give them the vitamin supplements, so at least they will not have vitamin deficiency. But as much as possible, encourage them to eat well, and then there's no need for you to buy drugs or give them vitamins. Yeah, the multivitamin do not boost appetite. That is not true. I know a lot of mothers believe that. You believe that when you give vitamins supplement, maybe children will eat better. It's not true. That is a myth. I don't know where it started from, and I don't know why a lot of parents believe it, but I can tell you for free, it is not true. Multivitamins are not appetite boosters. Vitamins are needed by the body for certain metabolic function. There are a lot of things going on in the body, and the vitamins are sometimes what we call the catalyst, the enzymes that that are needed to keep those reactions going. Okay, so that is why we need those vitamins. They are not appetite boosters. There are not there are no drugs that are appetite boosters that we recommend for children. None. I can tell you that for free as well. So when people ask, oh, what can I give to my child to make them eat? It is food. There is no drug you are going to give to children to make them eat. What you are going to give them to make them eat is still food. All right. So there are drugs that people give that are not meant to be appetite boosters. Those drugs have their own role for certain disease condition and all that, but one of their side effects is that they can increase appetite. Unfortunately, people now start using them for their side effects rather than for and what that means is that you're using a drug that is meant to be doing something else, but you are using it because it will improve appetite. But what about the other effect of that drug that your child does not need? So most of these so-called cipreptidine, appetite booster, and all those drugs, very dangerous, very, very dangerous for you to use. So please go and read them and read the side effects on them. Most of those drugs can affect the heart, they can affect the liver, they can cause so many things because those are not their role in the body of that child. So please don't go buy so-called appetite boosters for your children. Your children do not need them. You should encourage your children to eat. And I can see somebody say in vitamin D might be challenging during winter. Okay, for those of you living in uh, temperate countries where you don't have a lot of sunlight and and most of the time, even if your child goes out, even during winter, there is still sun. You don't need the sun burning your body to get vitamin D. But if you are not sure your child is getting enough vitamin D, of course, you are welcome to give them the vitamin D. So I hope I've been able to correct some of the misnomers, some of the beliefs around multivitamins. Multivitamins are not magical, they don't improve appetite, they don't, so just encourage your children to eat. All right, I got a few questions on Facebook. Nika is asking, should a breastfeeding mother take folic acid? All women of childbearing age should take folic acid. So whether you're pregnant, whether you're breastfeeding, whether you are not pregnant, whether you're not breastfeeding, if you are between 18 and 35, you should be taking folic acid daily. All right, because some of you may get pregnant when you don't even plan to. So, and folic acid deficiency crucial at some period of pregnancy when most mothers don't even know they're pregnant. So generally, doctors will recommend that if you are a woman between 18 and 35, you take your folic acid daily. Generally, when you're breastfeeding, most of the medication you were taking during pregnancy, it's still okay to take them as well because you are still, giving out a lot of your body. So it's okay to use the same supplements you were using during pregnancy. You can use them during breastfeeding as well. Triple Crown said my 3-year-old always has itching in the anus. What can I give him, please? Oh, that's the wrong question. The right question to ask is why is my child itching the anus? A lot of parents always ask that question. Like, this is what is happening. What should I give? It's always not the right question to ask. The right question to ask is what is causing my child to be itching, because that is actually what is going to determine whether your child actually need a drug or your child doesn't even need a drug. So for me, the first thing is that we need to examine this child. We need to know, is there something around the anus area? Is the baby bringing out worms? Some children can bring out worms, and when they bring out worms, it will make them itchy. Some children may have rashes around the anus, and that is why it is itchy and all that. So there are many things that could be going on around there that we need to know first. So if the child is having worms, we're going to give the worming drugs. If the child is having rashes, we need to give something to treat whatever kind of rash, maybe say bacterial rash and all that. You can see that the treatment is not the same, and it is not one thing that will make a child to itch the anus. All right, so for us as doctors, we are after the why. first before what to do. It is the why that will determine the what. If you don't know the why, you won't know the what. Otherwise, it will become like a babalawo method. Okay, so I'll recommend that you should. Okay, if you already deworm the child, so if you have dewormed him and he's still itching, then most likely it's not worms. So unless it's a different kind of worms and the kind of medication you give does not work for the kind of worms your child has. So, but the best option is to see a doctor first. I think they should actually look in the anus first, look at the area. Sometimes it be as simple as the fact that maybe the child is not even wiping after themselves properly, because some of us, for the 3-year-olds, they are not old enough to wipe after themselves, and I hope you are still helping them, even though they are now toilet trained and go to toilet by themselves, but they are not yet able to clean properly after themselves. So we should be helping them do that, because some children, it may be as simple as well that they are not cleaning after themselves properly, and there's a little bit of residue of everything, which of course will irritate them, and that will make them to age. It may be as simple as an hygiene issue. Okay, you need to make sure they're changing their pants regularly, and wiping and changing pants. Make sure they're using cotton pants and not silk or all this polyester stuff that cannot breathe. All right. So if you're doing the hygiene thing, you're changing the pants. They're using cotton pants that is breathing, and then the doctor needs to check whether there are rashes around that area than because that. Make sure when they rub vaccine on the body, these are eating part of the body that children sometimes don't rub moisturize. You need to make sure they are moisturizing everywhere. So if there are rashes, then doctor can treat as well. Sometimes we need to do some tests. We can do what we call a sellotape test, where we put the sellotape and we send it to the lab to know whether there is something coming out that we need to trace. So the first thing is to know what is causing the itching, and that's what will determine the right treatment. Achibong Lina say good evening, Dr. Gbemisola. Concerning multivitamins, my preemie baby has been on DHA, has safer consumers, and it'll be 5 months. Should we stop? You will not stop until you see your pediatrician. You cannot. So when your doctor starts your baby on any drug, please don't stop until the same doctor tells you to stop. All right. So it is the responsibility of the pediatrician who started the medication to determine how long they want to give the child. So preterm babies, will put them on supplements. And why we put preterm babies on supplements is that some of these supplements are passed to the baby in the last trimester. So just before the baby is born, that last trimester is when the mother is packing all those things to the baby. So iron and all those stuff, they are transferred to the baby in the last trimester. So babies that are born premature, they've not received those things from their mother. So they were born with a little bit of deficiency of some of these iron and everything, because they were born too early, before the last part of the pregnancy, when those things should be passed to them. So that is why preterm babies are always being supplemented with iron, folic acid, and if your baby, some also give calcium and all that. So you should continue to give it until your pediatrician say it's okay. Preterm babies are also prone to having anemia of prematurity and other kind of anemia. So because of that, we need to monitor. So for example, if I'm the one following your baby, I'm going to be checking the baby's PCV and all that. So that's what will determine whether, the baby can stop taking them, or the baby still needs to take them longer. So, but since you're having an appointment with your pediatrician on the 29th, so just wait. See your pediatrician, let the pediatrician check the baby if they want to do any tests, and then they will tell you. But most of the time, we don't even stop that early. Most of the time, we are supplementing them for up to a year, even more. So, but it's good to have that conversation with your pediatrician first. And then you can also ask them when you're going to start complementary feeding, initially from 6 months. You didn't tell us how preterm your baby was. Was your baby born? It's always good to give us an idea of how preterm your baby is, because that would determine some advice as well. Okay. If I must say, what does it mean when they say baby can sit with support? Okay. Thank you. That's a very good question. So, so we have what we call sitting with support and sitting without support. So when sitting with support is the baby can get into the sitting position, but they are not able to sit on their own without you putting either yourself behind them or some pillow or some cushions. If you don't put anything behind them, they will be falling forward or falling to the side. So they will sit, but they can't sit straight. They will be either bending forward, but if you sit behind them and you give them that is what we meant by the support. You sitting behind the baby will be that support. So usually babies, when they start to sit, 5 to 6 months, they need to sit with support. All right. And please don't keep baby sitting for too long. It's not a punishment. Some mothers want the baby to start sitting so much. You keep them sitting for minutes. They shouldn't be sitting more than 5 minutes at most at that stage. So let them lie down, all of that. So but by the time baby starts sitting without support, which is between 7 to 8 months, then baby will sit on their own and balance well. You don't need to put a pillow, you don't need to sit behind them. They will sit and their back will be straight. So that is sitting without support. Sitting with support, they need something behind them, otherwise they are falling forward a bit or bending a little bit to the side, or they need to put their hand down to support themselves. So that's what it means. I hope that is clear, Ifama. And how's your baby doing? I hope the thing has stopped. Okay. Let's blessings. Yama, say good evening, prolific doctor. Oh, thank you. My baby of 2 months failed to thrive. Okay. I have seen the doctor. Okay. He noticed sunken fontanelle, which Yoruba calls Oka. No, Yoruba, it's not sunken fontanelle that is Oka in Yoruba. Okay, but let me just finish your reading. I was encouraged to feed every 2 hours. Okay. My question is, will my baby meet up with his normal weight, or should I add formula? So what is the weight of the baby now? Because you've not told me that. That's important information I need to know. So if your baby is 2 months old, maybe it's weighing 3.3, what is the current weight now? So we will know how. I want to believe what you said. Your doctor say your baby is failing to try, but I really like the facts. So the fact is what is the current weight of the baby, and you're doing exclusive breastfeeding. Did your doctor admit your baby to the hospital? Did they get you to express your breast milk? Because that is what we do for babies who are failing to thrive. We need to be sure you are producing enough milk for your baby. So we have to be sure, because there are many reasons why a baby may fail to thrive. It is not all about food, okay? Because the question you are asking me, it presupposes that you are not lactating enough. That is when you will now start asking about formula. But that may not actually be the reason why your baby is not thriving. That is an assumption. So which is why I really want to have all those extra information. Number one, what is the current weight of your baby? Are you lactating? How do you know you're lactating well? Is your baby attaching to the breast well? And is baby sucking? Are you able to express, the quantity that is coming out? Because usually for me and most pediatrician, if you say your baby is not thriving, the first thing is that we're keeping you in the hospital, and we are actually going to monitor the quantity of milk getting to the baby. So we need to know that the baby is getting enough milk, because that is the first thing we want to do. And we sometimes have to do it by we have to monitor that feeding. So we actually ask you to express. We see the quantity that is coming, we see the quantity that is getting to the baby. So if we establish the fact that the baby is getting enough milk, and then the baby is still not gaining weight, then we have to look for all the reasons. Okay, it's most of the time it's not a formula issue, unless you are not producing milk, which is very unlikely, really, because again, we have to make sure you are attaching your baby to the breast properly, making sure your baby is sucking on the areola, not just the nipple. All those breastfeeding week kind of information we did last week, you may want to check on that. So we need to be sure you are doing the right thing, and you are lactating, and you are producing enough milk, and you are feeding the baby properly, and then we monitor the weight of the baby as well. So that is how we establish that, okay, feeding rolled in or rolled out. So if you've done that and the baby is still not thriving, then we're looking for other medical reasons. Some children may have holes in the heart. Children may have problems with their kidneys. Children may have problems with their liver. There are many reasons why children may not thrive. So it is not always food. And you don't always need to jump to the formula first. Unless we have reason to believe that the issue is that you are not lactating at all. And most of the time, we also want to make sure we help you to lactate, because breastfeeding, again, demand and supply. The more the baby suck on the breast, the more the milk will flow. And if the milk is flowing and baby is sucking well, then baby will gain weight. So if baby is sucking well, milk is flowing, and baby is not gaining weight, there must be something else going on. And that is our job to figure out and deal with it. So if you are still listening to me, if you give me all those information, I'll be able to guide you further. But it's a little bit there's not enough information at this time. All right, David Salamatu say, good evening. My son of 4 months, birth weight of 2.9, current weight of 6 kilos. He always like lying on his left side, which makes his head to bend. Okay, baby should lie on their back. Okay, I see a lot of parents. In fact, there's a mother that puts a puts a post, and she sent us a picture of her baby beautifully lying on the back, and she was really worried that the baby is not lying on the side. And I'm like, seriously, this baby knows more pediatrics than the mother. The baby knows they should lie on the back, so baby should lie on the back, not on the side. All right, their head, you can turn their face to one side and you can always switch it anywhere, but the rest of their body, the trunk, should be on the back. Okay, so your baby should not lie on the side, they should lie on the back. And whether your baby lie on the side or not is not what is making their head to bend. That is an assumption, it is not true. Okay, so if your baby's neck or head is bending, most likely baby has what we call torticollis. That is a medical condition on its own. It has nothing to do with lying on one side or not lying on one side. The only people that even preterm babies, those are the ones that we worry about flattening of their head, because they don't tend to move their body a lot. But term babies, baby born at 2.9 kilos, is a term baby, normal weight, that baby is not going to have any flattening or any bending because of one side, because they move a lot. So you should see us, you see a pediatrician to know why your baby's neck is bending, and not assume. But all the same, let your baby always lie on the back and not on the side. But for the head bending, you need to see a pediatrician so that we can evaluate that further. Ashibong Lina, he said we was born 33 weeks, is a near term baby. 33 weeks old is a near term baby. So just see your pediatrician, and then they will but your baby was a little bit small for age, because at 3 weeks, your baby should weigh more than 1.4 kilos. 1.4 kilo look like that's of a baby that should be like 28 weeks or something. Anyway, but it's good that your baby is on supplements, and I wonder whether there are other issues with the baby, which your pediatrician will know more about anyway. So I'm glad that you have an appointment coming up, so they will take it up from there. All right, blessing. Isioma, I need to go back to see what your own question was. Okay, your baby was weighing 3 kilos at 6 weeks. Okay, so your baby has lost weight. Yeah. Okay. If your baby's lost, so most babies will lose weight in the first 10 days of life, then they regain their birth weight by the second week of life. And so they should be back to 3.3 at second week, and by 6 weeks they should at least have gained close to 1 kilo. So we should be going close to 4.3 if nothing else. So I can understand why they are worried about the failure to thrive, and they are right. The first thing we need to establish that, are you really feeding this baby? But I guess they are not too very worried, because obviously this is your first time of going to see the doctors. So what they are trying to do is to for make sure you are establishing the right feeding. So I think the question for you is to make sure you are feeding your baby properly. I don't know whether you followed all our breastfeeding week. Last week we talked a lot about breastfeeding, attachment of the baby to the breast, how to know. Have you watched all the breastfeeding videos? Because I think that's where to start. Because the videos will show you how to attach your baby to the breast, how frequently you should feed your baby, how to know your baby's getting enough breast milk and all that. So do that first, and just you can also express as well. Just be sure your baby is getting that milk. Every 2 hours is fine to feed the baby, but we need to make sure your baby is sucking well and the milk is flowing well. So, and then you need to go recheck the weight. For you, I would say I want to check that weight again in a week or two instead of waiting for 1 month, because baby has lost weight. So we need to check that the baby has started to regain the weight. So it's important to monitor, and then we'll see how it goes. All right. Our time is running, and I've got a few more questions. Let me see. Instagram people. Instagram people. I've got a question on Instagram as well. Okay, I'll come back to it before you disappear. Tell me, Holawale, say what causes sepsis? Sepsis basically means there's germs, okay, multiplying in the blood of a baby. Okay, so they are caused by germs. It could be bacteria. That's the most common one, but we could also have other germs. So whenever we have too much of a particular germ in the blood multiplying, that is what we call sepsis, and of course that will manifest as symptoms: fever, baby refusing to eat. If it gets to the brain, baby may start having convulsions, having meningitis. It can get to the lungs, baby can have pneumonia. It can get to the intestine, baby can have diarrhea. So there are many symptoms that you can see in sepsis, but the underlying thing is that there's an infection that is circulating. So the question is, how does the germs get into the blood of the baby? Many ways. Most of the newborn babies through the cord, through the navel. That's why navel, the way we clean the cord is very important, because that cord is straight to the liver, straight to the heart. So you need to keep it clean. Also, germs, everybody coming, touching the baby without their unwashed hand, full of bacterial infections, all those ways, even from the hair. So many ways that infection can get into the baby, either externally or then gets into the blood. So that is how sepsis happen. And babies are usually not very strong in resisting infection because their immunity is still very low. So they can easily become very sick. And so they really need to be taken to the hospital. If you want to read more about sepsis, we have an article on infection in the newborn babies on our website, which you can read. All right, Miss Fumi say my 12-month-old have been having nasal congestion for weeks. I've been giving him vitamin C, stimulation, saline drops. It's been 3 weeks. Your child has nasal congestion for 3 weeks. You should see a doctor. Okay. We need to be sure it's not something allergic that needs other form of treatment, and keep the baby away from people with colds and coughs and all that. Most cough, most catarrh and all those kind of things, they are due to viruses. Most of them will resolve within 2 weeks, as long as the child is not being exposed again, which is why I'm going back. So, but if it's something allergic and the child is being exposed to the cause of the allergy again, maybe it's smoke, maybe it's perfume, maybe it's dust, pollens, whatever, then that will go on for a long time, and that treatment is a bit different, and so we may need to give anti allergic kind of medication or steroids, inhalers, and all that. So you may want to see a pediatrician or ENT doctors for that. All right, last question before we go. I think it's say my baby is 3 months, weighing 5.3, with the laying of the back. The more the baby lay on the back, the more her head seems flat at the back. Is most of those things are just parental assumptions. Just leave the babies alone, their head will be fine. And it is the even preterm babies, they are the one that tend to have like flat head, because, and we're talking about very preterm babies that have lied on their back. How many hours do we be lying on the back for 10 babies? You are carrying them home, they are feeding, they are not always putting their head down, if that's what you are trying to get to. And for 10 babies, they move a lot. So they are not, no 10 baby is having flat head because they're lying on the back. That is an assumption, or that is just what you think is making baby's head to be flat. And the baby's head has still very malleable at that age anyway. So it is not like the head is flat or anything. It's going to reshape with time as they get older. It's nothing to worry. Please let your baby sleep on their back because of what we call sudden infant death syndrome. Okay, babies can die by lying on their tummy and all, getting their face blocked, and all that. So it's a very serious thing. So based on research evidence, we found that the best place to keep babies to avoid them dying suddenly from what we call sudden infant death syndrome or cot death is to put them on the back. You can go and research that as well. So please put babies on the back. Their head is not getting flat because they're lying on the back. That is usually an assumption. Some babies will have flat head. Normally, the back of the head may be flat. Sometimes that's how some babies are born. That's not the way the fact that they lie on the back. The only set of babies that we know that can happen are the very preterm babies because they stay long in incubator, and most of the time we have to turn them because they don't move a lot. But not all these big babies that you guys are talking about. All right, so I'll leave that there. Yeah, the neonatal were informed that he stopped growing, I think, due to too much sugar. So okay. You are talking about your baby being born. Okay, so maybe you have diabetes in pregnancy. Okay, all right, maybe. All right, I understand. Since I put to bed, I have knee pain. You need to see your doctors. Have you gone back for your postnatal care, postpartum check? Anyway, so please see your gynecologist or your general doctor for your postpartum check. You shouldn't be having knee pains. There's something about having a baby and knee pains, okay? If you have any symptoms whatsoever, you must see your doctors so that they can take it off from there. Sorry, I'm not a adult doctors. I can only recommend paracetamol for you, but you have to go see your own doctors. I try to abide in my own calling. So, but see your doctors for follow up. And I hope you are walking around and you're not just sitting down. Sometimes you just need to move around, exercise, but see your doctors also just to be sure there's nothing else in your going on with your knees as well. Okay. All right, thank you so much. My time is up. I've gone 6 minutes above time. But if you still have questions about the health of your babies, feel free to post your questions on our Facebook group. Uh, Unfortunately, we can't do that on Instagram. Some of you send us DM and say, can you ask a question on our Instagram DM? We can't. The way Instagram is structured, it doesn't allow for that. But Facebook allows to have multiple people doing the same thing, and we have a bit of control over that. So please post your questions Monday to Saturdays. We will try and answer them. And some of these topics that we've talked about today, we've talk about them in length. We usually have what we call a webinar. So hopefully we'll get back to them now. I have a little bit more breathing space where we talk about each of those topics in details. Some of them like the sepsis, all of them. I don't think there's anything anybody has asked that we have not had like a group discussion in whether we take that topic and break it down into details. Okay, somebody has a question about the ORCA and all that. Did I answer that question? I can't remember. Anyway, sucking fontanelle is usually dehydration. Yoruba people always think the fontanelle is ORCA or anything. No, it's not a disease. The fontanelle is more like a mirror. So if the baby it's just a hole, it's just a space in the head. Okay, so if it's sunken, and for a baby who is not gaining weight, it means your baby is not getting enough milk. That means the baby is a little bit dehydrated. So what we really need to make sure is your baby is getting enough. So if your baby is sucking, that's why they say you should be doing every 2 hours. The baby is sucking well, getting enough milk, then the fontanelle will not be sunken. Sometimes if the baby has infection in the brain, the fontanelle will be raised, it will be tense, it will be what we call swollen, and tense, raised anterior fontanelle. So the fontanelle just tells us what that is going on in the body. The fontanelle itself is not the problem, it's just a space. It tells you whether there's enough, the baby is dehydrated, it's sunken, or if there's something going on in the brain, there's raised intracranial pressure, it will be elevated. So it's just a mirror. So it's not a disease. So it is not the fontanelle that's making baby to lose weight, which is what Yoruba Oka. People sometimes call Oka. There's no particular Oka. So don't go buy native drugs or whatever for the baby. I wanted to talk about that before, but I remember I forgot. I was carried away by the other part of the question. And I've written an article, and I think it's the most read article on our website, My Baby Has Oka, and I dealt with it thoroughly. So you may want to visit that article and read about it as well. All right, so thank you so much. If you have any question, please post on our Facebook group, and I'll come back by God's grace next week, and we'll continue to answer your questions. Have a wonderful rest of your evening, and it is bye bye from me. Bye bye.